Well, hello, everybody. Welcome to our Start or Sit podcast, going into week 14 of the NFL season. My gosh, it's gone by fast. Here we talk about injuries in the previous week or players that may have an injury, and we're talking about, are they going to start or sit in the up-and-coming football game, particularly for you fantasy football players out there that may be deciding whether to start or sit this player. Big name here. I'm going to throw it at you right away, Dr. Hawkins. How are you?
I'm doing great this morning. How about yourself, Shannon?
Wonderful, wonderful. Hey, big name here. Lamar Jackson, PCL sprain in his left knee. We've talked about ACLs a lot. Occasionally we hear about the PCL. We probably should take an opportunity to review the anatomy and kind of the mechanism of injury. And then do you fix it, or do you know what's the deal here with the PCL?
Yeah, so it's one of those four sort of cornerstone ligaments in your knee. So the ligaments are the ropes that go bone to bone and help stabilize that joint. So the PCL is the posterior cruciate ligament. It runs from inside the knee, from the front of the femur backwards at an angle to attach to the tibia, the lower bone. And so the classic injury in a football player is where they fall hard directly on the front of their knee with their knee bent to 90 degrees. And so what that does is that pushes that lower bone, the tibia, backwards and causes that ligament to stretch, or in real severe circumstances for it to tear completely. It's a little bit of a different animal when it comes to treating it because even though it sits inside or adjacent to the ACL, around the knee joint, it's actually outside the lining or the synovium of the knee joint itself. So it actually has a propensity to heal as opposed to something that's completely ruptured. And even when it's completely ruptured on an MRI, those fibers can sometimes knit together. So this is an injury that is very common in pro athletes, especially football players. I think we've talked about before that it's probably the most common knee ligament injury that is sort of undiagnosed, meaning somebody kind of falls hard, has a sore knee, returns to play at a lower level than, college, and they may have sprained their PCL and never know it. And it's picked up years later on an exam when they have a little bit of laxity in their knee. But that person has returned and is back playing without any symptoms. So in Lamar's case, it's going to be a tough injury for him because it definitely affects your ability to move quickly. It affects your ability to have good balance. And those are things that can get better, but it takes a while.
Yeah.
And so I think last year we dealt with the PCL injury for Ezekiel Elliott, and everybody was kind of down on, is he kind of over the hill? Is his career going downhill? And he's come back much better this year after he's had time to really, really rehab it. So it's one of those injuries that you can get back. I'm pretty sure he will sit this week, but, it's probably going to affect him, when he comes back in the next maybe 2 to 3 weeks. He's not going to be as mobile. He's not going to be as quick to do things as he normally does.
Yeah, and he is not just your quintessential pocket passer. This guy is essentially, he has to be mobile to play his game. That's what I see anyway. So most likely he's going to sit this week. Keep an eye on him. He may need another week, but he should be able to get back within the season at least. But keep an eye on him. Is that what we're kind of talking about right now?
Yeah, I think that's exactly it. I think he's going to be out for probably 3 weeks total. And then when he comes back, he won't be as productive with his running.
Yeah. Dr. Hawkins, how long have you been an orthopedic surgeon? How long have you been doing this?
Ooh, we're up to about 22 years now in practice.
22 years in practice. Let me ask you, in 22 years, how many PCLs have you repaired off the top of your head? Just kind of asking a question here.
Less than 10.
Less than 10. In 22 years, less than 10. How many have you seen? I mean, just out of those 10 that you repaired, you've probably seen hundreds of these. And this, again,
exactly.
is an injury that goes undiagnosed. I mean, it's a PCL. I find it to be not as viable to the knee stability as like the ACL. So, again, this athlete, this can heal, and they can return. You mentioned Ezekiel Elliott, so he's going to be out. Lamar for a week or two. Keep an eye on him, but he should come back. Good stuff. David Bell, Cleveland Browns, wide receiver. Don't have a lot of information here. We know he has a hand injury, but we really don't know. But he's a wide receiver. He's got to catch the ball, and if he's got any kind of injury to his hand, that could be difficult.
Yeah, so he's a rookie this year, and kind of coming into his own a little bit. The good news is we haven't heard anything as far as needing surgery, so that usually indicates no fracture associated with a hand injury. I would typically think that this is either some type of a soft tissue sprain in the hand. Sometimes they'll classify a laceration as a hand injury. So I think he's going to be somebody you have to kind of watch him a little later this week and see if he gets back to practice at all. But right now it doesn't look like he's going to be missing time because there's no decision about like injured reserve or doing any type of surgery. So He's not a high producer in fantasy. So it probably doesn't matter as much to some of our listeners to the podcast, but basically, I think he will play, but he probably will not be as productive. Like you said, he's going to need his hands, and even if he's back and running routes, he may be dropping balls a little bit easier than he should.
Yeah, good point. This is, with a wide receiver, obviously you can't tape these things up and put a cast on them. That Q-tip cast we talk about, where sometimes you see linemen with hand injuries or linebackers, they can play with that club hand wrapped up, so to speak. This guy, as a wide receiver, just can't do that. So he will probably play, but his production could be a little bit limited, or he could have some difficulties. Good stuff here again. Courtland Sutton, Denver Broncos wide receiver. Got this nagging hamstring things. They're talking about day-to-day with him. Denver's in a tough season here. What I see, Denver's in a tough season. So what do you think here? Courtland Sutton, wide receiver.
Yeah, I think he's our classic example like we've had with Keenan Allen and some of the other guys this year. They have these sort of soft tissue injuries. It's a stretch or a pull in the muscle. That tissue's trying to knit together. And so they really don't know until they go out and go through their warm-ups and try to push themselves whether they feel okay. I think the biggest predictor, Shannon, for him is just how bad their season is going right now. Guys like him, I see, basically telling their trainers, hey, it doesn't feel that great, and not playing because they're just kind of worried that they're going to hurt themselves worse. And there's little positive to trying to go out and push hard. So I would sort of sit him this week. I think the day-to-day comments about his injury are actually coming from his coach. So I think his coaches kind of knows the writing on the wall as well about their season. Yeah,
good point. So Courtland Sutton, for you listeners out there, is most likely a sit with a hamstring strain day-to-day. That's the conversation that the coach had. Here's another big name. Boy, this guy's on fire. I feel bad for him because he's been doing really good. But Jimmy Garoppolo, San Francisco 49ers quarterback, producing the 49ers on fire. They have the best defense that I can see in the NFL. And Jimmy had a left foot fracture, they called it. I think they were concerned about a Liz Frank. A little bit of confusion here because I recently read where they're not really calling a Liz Frank, and he may return, but I don't know when. Do you have any other information on Jimmy Garoppolo?
Yeah, so two things. So first of all, they had a lot of good footage of his injury and kind of what happened. So he had his foot sort of planted, but it was sort of in a situation where it's what we call dorsiflexed, and that basically means the foot is pulled up towards the front of his body as opposed to bent backwards. And so the person rolled up on him in that position. So the good news in just looking at that mechanism of injury, that's not the typical way that we see a Liz Frank sprain happen. And he kind of got stepped on the lateral or the outside aspect of his foot. So the combination of them basically saying, hey, it's not a Liz Frank injury and that he may be coming back, my assumption is, he had some type of metatarsal fracture, probably in the lateral aspect of the foot, not the type of stress injury, the Jones fracture that we see sometimes where people get a screw put into the fifth metatarsal to stabilize it. So it's probably like a fourth metatarsal fracture, something that's well aligned, and that they look at it, that's sort of internally splinted by the metatarsals, the long bones on either side of it. So the third and the fifth, if it's a fourth fracture, the third and the fifth kind of splint it. And so it's pretty stable. If it shows good healing, they will put him in a boot. They'll take his weight bearing away from him. They'll probably put what's called a bone stimulator on him to accelerate healing. And that's why, instead of like you or I, who might take about 3 months to heal, they're hopeful, hey, maybe this is a 6, 7, 8 week thing to be able to get back and play. And then they'll put him in like a rigid orthotic in his shoe to help avoid bending and stuff like that. So he will be a sit, but I think it's, if that defense can hold it together, Shannon, I think there's a chance he comes back during the playoffs.
Well, that's what they're saying. They're saying he should be available for the playoffs now. What I read, they were pretty excited that it was not a Liz Frank, which they suspected it might be, but now they're saying he might be available for the playoffs. But he's going to be a sit, probably a sit for 3 to 4, 5 weeks, maybe. Just depends on what's going on here.
Yeah, I think with how our season is right now, I think he's sitting for the rest of the regular season.
Okay, good point. Here's a guy, local guy here, Kenneth Walker III. Boy, we last Sunday in our win, Gino marched us downfield, and we scored, and we beat the LA Rams here at home in Seattle. Good job, Seahawks. But we lost 2 running backs. One of them, Kenneth Walker. He's been on fire lately. I watched that game. He just looked a little bit off in that game against LA, but we found out he has a right ankle strain. Now, they're calling it a strain, which is different than things we've talked about in the past with the ankle, which we've always talked about a sprain. A strain is usually dealing with soft tissue, muscle, tendon, etc. So what do we know about Kenneth Walker, running back?
Yeah, his injury again is a little bit nebulous. Pete Carroll came out and kind of described it as jamming the ankle. So I'm thinking that he's probably dealing, like you said, with a little bit of perhaps a muscle tear around the ankle, something that soft tissue wise might heal up a little quicker. The other possibility is he may actually have like a bony contusion. Yeah. So sometimes if you get a real hard axial or inline injury to the bottom of the foot and somebody comes down on you hard, you can have an injury where the talus bone hits up against the tibia, the lower bone of the leg, and you just basically have a big bone bruise there. And those are very uncomfortable. They're uncomfortable with weight bearing. But if you rest them and you get off of them, sometimes they can kind of heal up relatively quickly. Unfortunately, the Seahawks now are going to be in a situation, they're so limited with Penny out already, and even the backups for Walker had some issues. I think they brought in a guy who's been out since last year that was on the Giants as on their practice squad just to have some more running backs to try to help him out. But I think Kenneth Walker probably will sit this week. They'll try to get him healed up. They're doing well. I think they see an opening in their future with Garoppolo out to try to seize the West. So I think that he'll probably rest a week to try to get back and be more full speed.
Yeah, I think that you're right on there. I mean, based on the fact that I also read they brought in a backup from the Giants, and they're adding some depth to the running back. So I think they're assuming that he is at least sitting this week. So Kenneth Walker is a sit this week. But if you had him in your fantasy football for the last 4 or 5 weeks, you've probably done really well with him. So he is a sit right now. Our last player, this is kind of complicated in a lot of ways, but Tua. Miami Dolphins quarterback. He looks like he did something to his ankle, but they're talking about he went out of the game, but he may be back in the game. I think they have the Chargers coming up this Sunday, week 14th. Tua, ankle. You know anything about him?
Yeah, so they have good news on his front. He is going to play this week. He has such a long history of ankle issues going back to his time at Alabama and had those tight ropes put into both of his ankles. And so I think he's in a situation where they're always going to kind of look at him with a little bit of a careful eye. I kind of want to use the analogy of Steph Curry. So Steph Curry, early in his career, kind of got bit with a lot of recurrent ankle sprains. He would come down when he was shooting, hit a guy's foot, sprain it, and he got to the point where he was wearing braces all the time. And so I think they just erred on the side of caution with him, but they're already saying he's going to play. So I think he probably had a little bit of ankle discomfort, and they just erred on the side of, hey, let's just check him out, see if he's okay. But it doesn't seem like it's anything major from a structural standpoint.
Tua's a play this week. That's what you're saying. That's what you're thinking. And all indications are that's what I'm seeing and hearing too, is he's going to play this Sunday. Tua will play. Hey, Dr. Hawkins, just out of curiosity, we've talked a little bit about these high ankle sprains, and you describe it as this surgical intervention to stabilize those two bones, i.e. the tibia and the fibula, to bring those together. And you use, I would imagine you're taking and harvesting a tendon and then wrapping that tendon through those two bones and connecting them and bringing them together. That's that tightrope procedure you're describing. I would assume that tendon is absorbed and develops vascularization and blood flow, and that tendon becomes a viable biological tissue that's healthy. Is there any times where that engraftment is compromised, or is that tendon weaker just because it's got this new vascularization. I mean, how long does that take? You know what I'm asking here?
Yeah, no, I know where you're going with this. So again, when we're looking at putting a graft in between any two surfaces, when it's your own tissue, obviously it's alive, but you're taking it away from its normal blood supply and then moving it and hooking it up. So in those situations, there is this sort of process. They've kind of mapped it out in animal studies, that you go through this situation where new blood vessel growth comes in, and there's a point, usually about 6 weeks into placement of a graft, where structurally speaking, that graft is probably weaker, and then it starts to get back up to normal strength. So that's where we come out with a lot of the data that says even when somebody's doing well, say 6 weeks out of some type of ligament reconstruction, we don't want to push them too hard in that window of time, knowing that tissue is a little bit weaker and still kind of remodeling, and you want to wait until you get closer to 3-4 months to stress that tissue.
Good point. So in Tua's case, his surgeries were over a year ago, so he should be fully engrafted, and that shouldn't be a problem for him. So he should return and play this week. Then just wanted to kind of touch base on that, so our listeners understand that biological process, that engraftment. So good stuff, Dr. Hawkins. Thank you again for your time. Have a great day, and appreciate your input here. Okay.
Thanks very much, and you enjoy your day as well.
You too. Bye now.